Advocacy for All are celebrating their 25th birthday, and in that time, they have been providing advocacy in Bromley.
The NHS has asked us to find out what are the barriers to annual health checks for young people. Here's what they had to say.
One barrier is actually making the appointment, calling the GP surgery. You have to call at a particular time and it's always engaged.
It was easier calling the surgery before the pandemic. Now getting any appointment is worse.
At the GP surgeries, another barrier is health professionals who focus on the disability and not the person.
I had somebody that was a health professional last week, and I went to my GP. When I said yes, she said, "How is that possible? You were talking to me." And then she said, "You also have a job, so how does that work?"
You don't look like you have a disability. That is not a compliment.
See me as more than my learning disability or autism.
This is also felt when the health professionals only talks to the carer, support worker or family member.
Other barriers include communication and being understood.
Is when you go to the GP or to the hospital, is they don't understand you, yeah, and they don't know what to do. It's very hard for disability or autism to explain carefully or clearly to explain what you got. They don't take enough time to spend with you and listen to you carefully and make sure they understand.
Some people we interviewed were very happy with their health checks, especially with staff that had learning disability training.
The British Medical Journal writes that GP teams are tired and exhausted from COVID-19 and the pandemic. It is struggling because more patients need more help and it is difficult to keep hold of staff.
Our members are aware of the bigger issues around the NHS and their healthcare. But like during the lockdowns, some of our members feel that barriers to health checks and healthcare are still there, making them feel forgotten